I'm Dr. Nikia Grayson. I'm the clinical director and nurse midwife here at Choices. And I'm here with Miss Willie Westbrook. And Miss Willie has been with Choices for a long time.
I've been here 13 years.
So today we're talking about midwifery, right?
Yes.
So, I'm a nurse midwife, and I started my midwifery career here at Choices.
Mm-hmm.
And what really brought me to midwifery was recognizing that there was this gap and I wanted to fill that gap. And so I came here to Choices to start a midwifery program that would help to increase the number of Black midwives in Memphis and in the Mid-South. And so I understand that your relative, your great-grandmother,
Yes,
was a midwife.
she was, and she actually delivered me. She delivered basically in her community. It was a town called Collins, Mississippi, between Jackson, Mississippi, and Hattiesburg.
Okay.
And that she would go to the homes, and she had her son would help her, and she had a sister, a younger sister, that was helping her, and the church would pay her. She never did take chances on bleach babies. They would just call them feet first. And so her name was Sally Mae Hatcher, and I was told that she loved pink. She loved it pink, and she was always wearing pink, and they called them all pink. And they said that she had a knowledge of feeling the baby, the mother's stomach, to feel the heads, and when the child was actually going to be born. And she would always stay close to home when she knew that was the case. And they would come and get her. She used a straight razor to cut the cords.
Okay.
And then they said that she used shoe thread that she would keep boiling clean because the tie the umbilical cord. And she insisted the mother would stay home 10 days, and they used blankets and towels and cloth diapers. They had cloth diapers. And
So you said the church paid her.
the church paid her. It would pay her, I don't know exactly how much, but everybody went to the same church basically. And so they would get up a little collection for stuff like that. And so they would pay her out of I guess they called the kitty. And she would pay her son if he had to take some of them to the hospital.
Okay, yeah.
They had a hospital in Laurel, which was a larger town. And for instance, a bleach barrel for community.
I was in a small community that knew each other, and
Everybody knew each other.
and she was the county midwife. Huh?
Yeah. And like I said, she was kind of like a nurturing type of person. She would also help people that were sick, and she would go over there and sit up with sick people. I was told that she actually was sort of like a healer.
Yeah.
If you want to believe in that. Since she really hands on people also.
Yeah. Midwives, like the grand midwives, the Black midwives in the community, were seen as healers. They didn't just care for people who were pregnant or catch babies. They cared for people who were sick.
Yeah, that's what she was.
Yeah, and they would help them, give them medicine or herbs or things like that, and they knew what to do.
Well, she gave them corn whiskey.
She did.
She gave them corn whiskey. The ones that were nervous, and I made them relax them a lot. So she did that, and she had in a way she could get on to any medicine or anything like that.
But she knew what to do for them.
She knew what worked.
Yeah. And so she would go sit with people that were sick and care for them as well.
That's true.
Yeah. And I mean, I think that is something that was, really special about midwives in the community.
Yes, it was good to have somebody in the community that just took charge and stuff like that. And she was one of them.
Yeah. I think that's amazing.
And so she was just a sweet little lady. I remember her as always just a beautiful person. And she loved the Lord so very much, very much. And she was a good cook. She was a very good cook. I was born in 48.
Okay.
So it had to be around in between the 40s and the 50s. Everything was still segregated.
Yeah.
And so they just had they had this hospital in Laurel that accepted black people, but they had to come certain part, you know, it was a certain area in the hospital that they kept on as a ward that they kept black people on. And so now I know that for a fact, because when, like I was telling Katie, when I got sick, my daddy had to take me to West Memphis. We were living here in Memphis to see a doctor. And then I couldn't see a doctor here in Memphis. And that was when I was a child. So even though people before then.
And I tell my students this too, because like my dad, he was in the Army, but he could not vote because the Voters Act had not been passed yet. And so I just saw him a couple weeks ago. So I mean, it's not that far removed from us that you know, the segregation and the discrimination and the Jim Crow that we, you know, that we and our families experience.
It's still going on. It's still going on.
It is still going on, absolutely. And so, you know, it's just in a different form now.
That's true.
You know, but we see it every day. And but yeah, it definitely was more. I don't even know if it was more overt then. I mean, I feel like in these last few years it's been pretty overt too. Right?
It's true. It's so true.
And
it's
so
sad. It's just like you say, a different form. And the Black Lives Matter it's kind of bringing a lot of it out. But it's not changing.
No, it's not.
Unfortunately, I really hate to say that.
I hate to say it too. I mean, because you know, I think that you know. With the Civil Rights Act and really, you know,
we have came a long way.
But we really haven't.
We really haven't.
And it's unfortunate because it's we see it at every level. You know, politics. We see it at our health care, which is why we see the need for black midwives. You know, and you know they say midwifery is a calling, right?
Yes.
And so I was called to do it, and it called much
I'm
later.
So glad.
And I'm glad I answered the call, right?
And I'm glad you called here.
Right. Yeah, I know. I'm glad I answered the call because, you know, I definitely never saw my life going this way.
Is that right?
Yeah.
Well, I'm so glad that you came to Choices because you have really brought this clinic. You brought a lot to it, and thank you so much for that.
Well, thank you. I appreciate that. You know, sometimes, like, you know, they say you can't see the forest for the trees. You know, you're doing the work, you don't necessarily always see the fruits of it, right?
But other people do.
Yeah, and other people do. And that's always, you know, that's good.
And you seem to bring out some of these older traditions that the young women didn't actually know that they had choices to get and have midwife, midwifery. They thought that they just had to go to the hospital and have a baby delivered. And now I've seen, since you've been here, so many women coming in to have their children delivered here through that.
It's
they trust it and trust you.
They do trust it. They trust it. You know, it was so important to me, you know, when I decided to be a midwife. I knew, you know, I could definitely care for people, and but to me that was too small. That was thinking very small. So how do we broaden it? How do we broaden it? How do we bring more black midwives to the South? So how do we educate them to get them to want to do this as well and be caregivers for their communities? And how do we get the community to trust us? Right. And so that's a big part of it too, because we can build it, but if they don't trust us, then they won't come. And so and so fortunately we have a great team, and you know, I say it all the time. I thank Rebecca for taking the chance because she didn't have to, and really helping us to create this here. And so, but yeah, I love it. I love the people I care for. I love the families, and I love talking to them and being with them. And I see it as an honor to be able to provide care for them.
Well, my grandmother would be proud of you.
Well, thank you. I appreciate that. Yeah, I think about my grandmother every day. I don't know if I ever tell you, but my grandmother and I were very close.
That's good.
And I think about her every day. And I think that she would be proud of who I am and the work that I do. And I want her to be happy. And I believe she is.
All right. That's